Today we actually have BCX as the sponsor and some of the management-led staff and the chairperson of the Public Sector ICT Forum. And the big topic that we have today is making sure that we connect the unconnected in health. It's very important to understand digital technology enhances how you can make healthcare available to some of the members, especially in the rural areas where we utilize things such as telemedicine, making sure that you have proper connectivity, getting the right private and public partnerships. Hence, that is why digital technology actually is a major part of that, such as AI, patient records, IoT, some of the bots. Those are some of the big and strong elements and some of the discussions that we had today. We have a very highly unequal two-tier system of private healthcare and public healthcare. Public healthcare is 84% of our population. Private healthcare is 16% of the population, but 50% of the healthcare spend is towards private care. Hence, the NHI will bring that balance into play to make sure that we have affordable healthcare to each and everyone, irrespective whether they're employed or unemployed or their socioeconomic status.
So as BCX, we've come together, we've brought the best minds together. We've created a community and a platform which gives us the ability to not just react to what we're doing in terms of the solutions we have, the connectivity we have through our group of companies like Telkom, but it gives us the ability to listen, to harness into what's actually going on out there in the market, and then to take that information back and develop proper solutions that are scaled towards our economy, scaled towards our country, scaled toward the NHI, and that's going to start to solve the real problems out there. As humans, we are limited in our resources, limited in our thinking, limited in our capabilities. Through digital technology, we are enabling data that will give us better insights into how to deal with issues around healthcare, how to solve these issues faster, and how to be more responsive rather than reactive towards the situation we find ourselves in, namely the COVID pandemic. It was only through data that it gave us the opportunity to make real clinical decisions based on what we knew and based on what was factual in front of us. Technology enables data, data enables healthcare. Through connectivity, we are now able to touch those who haven't been able to be in reach before, but it also gives us the position which allows us to see and respond a lot more faster, a lot more accurately. Telehealth, remote health, palliative care, all is super reliant on connectivity being the enabler to get us to that outcome.
You know, things like our rural clinics, being able to get the same healthcare as the hospitals and the doctors in the cities, that's important because we need to bridge that gap. Because if we collectively think and we think together, I think we can really achieve so much like we have done in the past. And I think once we realize that goal of equitable healthcare for all, and we are aligned and we understand that this is so critical as a nation to get this right, to make sure the sustainability of our nation continues for equitable healthcare for all.